Good afternoon. We'd like to thank everyone for joining us for today's Health Department update. On behalf of Chairman Rand and Chairman Zimmerman and Chairman Krug from Peoria, Tazewell, and Woodford County, we appreciate everyone taking time to check in with us and get an update. We also are hoping everyone had a nice Easter weekend. We'd also like to wish everyone a happy Passover season as well. The big thing, I think, for us to continue emphasizing today is what everyone's getting tired of hearing about, because it seems like it's getting old and redundant. But the big thing for us to keep focused on, even as we see maybe some positive numbers coming out of the state, is to continue the diligence, continue to abide by the social distancing, and trying to do the best that we can to keep the pressure off our healthcare providers. So the more we can do that, the more we can emphasize that to our families, to our friends, to our coworkers, and so on, the better off we'll be, the quicker we'll come out of this. Now I'd like to introduce Monica Hendrickson from the Health Department.
Thank you, Mayor Artis. Good afternoon. The to-date counts as of April 13th are as follows. The Tri-County region has 59 cases to date. Peoria County is reporting 31. Tazewell County reporting 19. And Woodford County reporting 9 cases. The total number of deaths to date is 4. Tazewell County reported a death this morning of a male in his 80s. In addition, I do want to take the time to discuss that over the weekend there was a death reported by the hospital systems. The individual, a female in her 50s, was not a resident of the Tri-County region, but rather had traveled to our area and after developing symptoms had been admitted to our hospital. In regards to the hospital data, between OSF St. Francis Medical Center, Unity Point Health Methodist, Unity Point Health Proctor, and Unity Point Health Pekin, there are currently 22 ICU beds in use, 16 for persons under investigation, and 6 for confirmed cases. There are 30 non-ICU beds currently in use. And again, there is 1 death reported in the past 24 hours attributed to the Tazewell County resident. For Peoria County specifically, of the 31 confirmed cases, 9 are recovered, 18 are at home and self-isolating, 3 are hospitalized, and 1 is deceased. There has been a lot of questions regarding testing and wanting to know the current values or numbers of individuals testing. As of to date, the Tri-County has reported 565 negative tests. However, we want to point out that these tests are very limited. These tests are point in time, so an individual can test negative, but does not mean that they're going to be their status is negative continuously. That means at that point in time of their testing, the result was negative. And also, this testing is really limited to the testing done through the Illinois Department of Public Health Lab, as well as the LabCorp that is facilitating the community-based testing out in McLean County. What's not included are some of our hospital data and the testing that they're doing through their own lab systems. And that is because negative tests are not required to be reported to local entities. So again, to give you some perspective, we do know of 565 negative tests to date. But we also do know that some of our hospital systems are reporting over 200 negative tests. We do not know if they overlap with our current test numbers or are from other private entities. And that's why, while there is a lot of interest in understanding negative tests or how much testing is being done, every day it increases in capacity, but negative tests will never really give us a full understanding of the value of the illness throughout our community. In regards to Peoria County data specifically, in terms of demographics, 68% of our confirmed cases are female, and 58% of our confirmed cases are under the age of 60. We do now have cases reported for ages 20 to 99. By race, 58% of our cases are white and 26% of our cases are black. Recently, there's been much dialogue in regards to racial disparities in COVID cases and deaths throughout the United States. The Peoria City County Health Department has long understood how race, poverty, and where you live can impact your health. The Peoria County Board of Health, in conjunction with the Peoria City County Health Department, has been focusing on health equity approaches to addressing these gaps in our community, especially these health outcomes. To speak more to this, as well as the importance of recognizing the impact of COVID-19, I would like to introduce Dr. Nyala, who is a professor of clinical family medicine and director of family medicine obstetrics fellowships at UIComp, as well as a family physician with Unity Point Health Methodist and a Peoria County Board of Health member.
Thank you, Monica. So here is what we do know, and that is true. Our communities have suffered from centuries of educational, environmental, residential, and employment segregation. We suffer more disproportionately from sugar diabetes, high blood pressure, heart disease, asthma, and obesity. People with these diseases tend to die more from the virus. So if you take 3 or more prescription medications for any reason, you are considered higher risk of dying from this deadly virus. We're more likely to live with our parents and grandparents, and it makes being able to quarantine even more difficult. We tend to be more underinsured or uninsured, and this affects our access to quality health care. And when we do access care, there is evidence that there is disparity in the care that we receive. Minority people tend to work jobs that are at higher risk of exposure to the virus, such as food businesses, cleaning, nursing homes, and hospitals. We do also know that coronavirus does not discriminate. Because of all that I've talked about, minority people are dying more. So we need to work twice as hard. It's not fair. I know that. We know that. But we have to protect ourselves. Here is what is not true. We're not immune to coronavirus. It is not a white people's infection. Let us not make the mistake that we made with the HIV epidemic, when minority communities thought HIV/AIDS was a white people's disease, or even more so a disease of white gay men. By the time people realized the truth, it had spread like wildfire. Coronavirus is not only infecting and killing old and sick people either. Younger people are dying too. In the Tri-County area, just like Monica said, more than half of the cases are less than 50 years of age. People who think they are healthy are not necessarily healthy. It is because they don't have or haven't seen a doctor. Hence, no diagnosis of any disease have been made. What is the community doing so far? We know that Heartland, in collaboration with Unity Point Health, is being proactive in targeting homeless populations and group homes by providing primary care services and hence gathering baseline data. The Peoria County Sheriff's Office is not arresting people for small crimes. They are releasing people early, and they are quarantining first arrivals at the jail. There is also a contract with local hotels to provide individuals that can't return home. These are people that are otherwise stable, that are COVID positive, or they are patients under investigation, but will not be able to go to their homes because they live in communal settings. What do we need to do as a community, but especially as a minority community who are suffering more from this disease? We need to practice more hand washing, and we need to do it more frequently. We need to do social distancing. There should be no congregation more than 10 people in a space, and we should have 6 feet distance. This is serious, and we need to abide by it. We need to wear masks when we're outside, not just to protect ourselves, but to protect our family members. Because you might be healthy, but you might be a carrier. And so, by you wearing your mask, you are protecting your grandma, grandpa, uncles, aunties, and vulnerable members of your family and the community. We need to spread the news. We need to make sure our families and friends are taking this very seriously, because it is very serious. In Illinois, even though the population of black and brown people is 15%, 42% are dying from this disease, almost three times. I'm going to end by quoting Governor Pritzker's call to action to my healthcare provider colleagues. Healthcare providers and organizations must fulfill their obligation to care in an ethical and non-discriminative manner. No one life is more important than another. No person of color or disability must suffer disparate outcome due to a legacy of discrimination. We will get through this together. Thank you.
So open up to questions.
When you're talking about doing the demographics, white versus black in terms of who's being affected, have we looked at the demographics in terms of income level? Because it sounds to me like the things that Dr. Nala is describing is poor, is poverty, more so than race. We're seeing it, have we looked at the numbers in terms of, income and poverty?
So the question is, have we looked at the numbers in regards to COVID-19 in terms of income and poverty? And that data is not collected as part of a medical history, especially laboratory reporting. Laboratory results are your basic demographics. However, I would point to the fact that the Peoria City County Health Department has been actively looking at how race and place matter in terms of health. And our mortality reports that we've issued now annually show that there are disparities in terms of everything from lung disease, respiratory health, to heart disease in terms of where place and race matter. And one of the things that we do find out is that in our most impoverished neighborhoods, we have high minority populations, and it is very difficult from a statistical level to actually pull out the difference. And so reporting from COVID-19 particularly does not give us someone's household income. But based on zip code data, which we are collecting, again, and that keeps growing every day, we do have some understanding of that. But again, Peoria is a very diverse community in general.
Was the resident in Tazewell who passed away also a resident of Generations at Riverview?
No, the individual that passed away was not associated with the ongoing investigation that they're working through.
Okay. Were they a resident of a assisted living facility?
To my knowledge, no.
Do you know what county the woman who passed away over the weekend was from?
Cook.
Cook County?
Monica, speaking of these numbers, you're mentioning cases are recovered. Are you guys ever going to subtract those from the confirmed cases, or just keep announcing confirmed cases?
So the question is, in terms of our recovered cases, will we subtract them from our confirmed cases? And from the Peoria County's infographic that we're now updating daily, you'll see that our confirmed cases, if you were to calculate those recovered, those in their home isolation, those hospitalized, and those deceased, the totality would equal our total confirmed cases.
Are you all tracking presumptive cases with the positive cases?
We are aware of presumptive cases, but again, those are ones that don't have a laboratory confirmed definition to them. And so we are knowing them partly based on contact tracing or through some other avenues. So a great example would be if I were tested and confirmed positive, then I would be self-isolating at home, and my family members would be quarantining at home as well. Based on that, we would be working with those individuals in the household because they were the high-risk contacts to determine what their symptoms are or if they have any symptoms. If their symptoms were to change, rather than testing them, we would call them a presumed positive because we know they were in a contact with someone, a high contact with someone that was tested positive. So we would know that from those mechanisms. Likewise, if someone that lived in a congregate living setting or was a staff member of there, they may develop symptoms, talk to their provider, and their provider communicate that they don't necessarily need to be tested, but that we're going to presume it. They would still notify us as the health department because we are focusing on those congregate living settings, and so they're doing their due diligence to inform us. But again, for maybe the general public, we would not know all the presumptive positives out there. That's why I think the governor spoke about the pandemic healthcare workers, OSF being one of the agencies that's really spearheading this in Illinois. And that's going to be a great resource because they're going to be working with those individuals that are presumptive positives that don't necessarily have a positive test result, but can work through that program to, again, get their health needs met.
And just so you can confirm again, there was a death in Tazewell County, male in his 80s. The website says 3, but you said 4.
We are total in our area is now at 4. 3 in Tazewell County, 1 in Peoria County, and then the other that was reported this weekend was actually attributed to Cook County.
Are we aware of any healthcare workers this time who have tested positive for COVID-19 in Tri-County?
In the Tri-County area, I believe we have had some healthcare workers that have tested positive, and they are currently, I believe one is under recovery and the other one's at home isolation.
Did they work at either of the major hospitals, OSF or Methodist?
I'm not fully aware of those details.
Okay, so if has there been contact tracing done with those workers?
Yes, so when we have any contacts, whether it's a healthcare provider or a general member of the public, we will reach out to them and start contact tracing based on their exposure, and then we would immediately start contacting those high risk or those immediate contacts, household members, people they may have traveled with, people that they work with, and then again, even from that, working with those individuals' households and get those also on a monitoring system as well. So we do contact tracing. Whether or not they are a healthcare provider or they can be a person that just stays at home as well.
So have those workers, have their coworkers and colleagues been placed in quarantine?
They've been actively monitoring their symptoms, as well as some of them have been placed in quarantine.
Can you put a number on how many have been affected overall?
Of the ones that we worked with, that's really hard to say because it can fluctuate rather drastically depending on when we were notified of that case. So for example, early on when testing results were a little bit delayed, we might have been notified of a test result and determined that exposure or that symptomology started a week or 2 before. So by the time we were contacted early in the early parts of this response effort, those individuals were already out of their quarantine phases.
With the more cases popping up in the assisted living facilities, has there been any additional testing going on in these kind of facilities around the area?
So the question being, with cases increasing in our long-term care facilities, has there been any additional testing? All of those long-term care facilities in the state have been really proactively responding to this from the early onset. I think lessons learned from Washington really guided that discussion. So they've been routinely monitoring their staff as well as their residents, taking vitals every 8 hours, in fact. Likewise, they've limited visitors. They've decreased rotations of staff as well, just to, again, recognizing the fact they have a very vulnerable population. And the Illinois Department of Public Health has actually identified not only long-term care facilities, but any congregate living setting as a high priority testing. So if individuals are symptomatic, they are going to be prioritized for that state testing.
And that includes staff and residents
That includes staff and residents for all congregate living settings.
if they show symptoms?
Yes, if they show symptoms, because the testing we have right now, you need to have symptoms, again, to make sure that means that you have enough of a viral load that your test will come back more accurately if you were not symptomatic. Without symptoms, then you might have running the risk of testing a false positive or a false negative. And so really testing is focused on making sure that you have symptoms.
Monica, for Peoria County specifically, seeing some larger groups, kind of confirmed every day, are we attributing this to people being sent to the McLean County testing site, or are we looking at a lot of community transmission? What do you attribute these numbers to?
So the question is that I think on the 9th, last time I was in front of you guys, I think we reported that we were at 39 cases in our region. We're now at 59, so that's an increase of 20. And this really feeds back to the fact that we are on that upswing that we talked about. Now, as we see this growth, it is nerve-wracking to see it kind of start increasing, the ticks come up. But remember the fact that we put into those sheltering in place and those other restrictions so that we are hopefully seeing not as steep of a curve or as a high growing curve, or not as high as we wanted to, we initially thought it was going to be. So again, that plateau that's going to continue. The thing to note about cases is that regardless of this plateau or this peak, we're going to have COVID-19 in our community for an extended period of time. Even after there's any release of restrictions or stay at home, we're still going to see cases, and that number is going to still continue to grow. Likewise, deaths are still going to grow. The peak has nothing to do whether or not the virus is in the community or no longer in the community. It's going to be really directed around the capacity issues of our healthcare system and making sure that we were able to control it so that they are not in surge capacities or overburdened. But we will continue to see cases as well as deaths throughout the year.
Can you tell us how many hospital beds we have available and how many are being used?
In terms of overall usage of beds, I do not know. I only know for information regarding persons under investigation and those confirmed cases of COVID. Overall, we have about 300 ICU beds and close to 1,000 non-ICU beds in our area, is my understanding. And so again, our numbers to date is that reporting for the 4 hospitals, there are 22 ICU beds currently used for COVID-related and 30 non-ICU beds. But again, ICU beds and non-ICU beds are used routinely throughout the day for people giving birth to heart attacks, through you name it.
So playing off of Caitlin's question, go to the IDPH's website for this area, the 2 places receive most confirmed cases, keeping in mind the caveats that, testing is not terribly widespread, and we should assume that there's more cases everywhere than what we know. The 2 zip codes that have the most confirmed cases are 61611, which is east of Peoria, and the 61615, which is like the northern part of Peoria. Can we talk a little bit about, those 2 areas specifically? Is there any specific reason why there's more test results popping up there?
I think the more test results for each of those areas can also be attributed to the fact that they also have large numbers of long-term care facilities. The testing in regards to, I think the question that was posed about knowing that there's a focus on long-term care facilities and that we have these outbreaks and that we're investigating through it, part of that means that we're doing much more testing in those areas as part of outbreak control. And the 61615 and the 6101, I believe, is East Peoria.
61611.
Yeah, those are all connected to those long-term care facilities that are currently being investigated.
I have a question for
Dr. Nala?
Doctor, you discussed not wanting to make the same mistakes that you mentioned, HIV, for example. So how do you think we reach the populations that you spoke about so that we don't make these same mistakes?
So the question is, how do we avoid not making the same mistakes that we made about the myths that were spread about the HIV? How do we reach that population, correct? I think we have to educate the minority population, because that was how it stemmed from. From what we hear with the coronavirus is that people there was information spread even through some of the religious houses saying that, oh, it's just a white people's virus, don't worry about it, you don't have to do anything. And so we really have to go to people where they are at and say, no, this is not a discriminative virus, it's affecting everybody. And we have to be serious about it. And we can drive our information with data, because we see the data. The data shows that in places where just 1/3 or 1/4 of the population is blacks or brown, over 2/3 of the population is dying of the blacks or brown. So what more proof do you have than that? I think the information really has to just hit that group of people, and we have to keep saying it over and over. I think people are getting it, but we just have to keep talking about it. And also not just talking about it, but also putting infrastructure in those areas, because people don't have the luxury of isolating like we do in 61611 or 61525 where I live. They don't have the luxury to isolate. People are living together with grandpa and grandma. So if you're positive, first you might not know because you're healthy, but then you have 80-year-old grandpa with heart disease and stroke and diabetes, and they get it, and they are the ones that are going to be in problem. So I'm happy that the state is investing some money, the city is investing money, trying to test people, but especially people who are positive and that are not able to go home, so that they are not going home to go infect their family members. We can separate them and put them in hotels until they get better.
And Doctor, I know you said we need to work twice as hard, we meaning minorities. Are you saying minorities need to do everything twice as hard when it comes to preventing the virus? Or are you just talking about minorities in general working twice as hard?
Twice as hard as in, let's wash our hands, let's wash it more frequently, let's practice this social distancing and take it seriously. This is not the time to attend parties or funerals or go to church. Let's stay home, because that is how to prevent the spread. So when I say that we need to take it more seriously, and some people don't understand, oh, it's just the old people. Like I said, the data is not saying just old people. Younger people are dying too. Especially some people say it's people who are sick. You might think that you are healthy, but you just think you are healthy because you don't have a medical home. You haven't seen a doctor in 10, 15 years. So you didn't know you have asthma. You didn't know you have diabetes because nobody has tested your blood sugar before. Guess what? If you have the coronavirus, you're going to die because you have all those diseases you just didn't know. So that's why I'm saying we have to work twice as hard. Just assume that we're going to get it, and we're probably going to go down faster because we don't have the luxury to be apart and to heal faster than the rest of the people.
Thank you, Dr. Ella.
Monica, I have a question for you. Any idea why there are so many women who have tested positive in Peoria? I mean, typically it's sort of a disease that's harder on men. Any idea about that?
So I can't speak to necessarily because why women are being tested at a higher, or confirmed cases are tested. I think that's the key. Is our confirmed cases, we have a larger population of females. I can say from the data from our negative tests, our overall tests, it's actually about 50-50 in terms of who's been tested. Okay. So our confirmed cases, we have more females that have confirmed cases. So I think that's the difference in that kind of nuance right there.
But no idea why.
The more confirmed cases are female. You know, I can determine a couple of things. One is if you're thinking about this age range that is the high vulnerable population, also those that live in congregate settings such as nursing homes. Overall in those communities, you're going to have older females that live in those settings. The truth of the matter is, from a mortality data point, is that females live longer than males, and they tend to live in those nursing homes more so than their male counterparts. And with those focused interventions and testing, and as previously mentioned, even those outbreaks that we're investigating, we're going to be looking at that population.
Is there any update on the 4 points? Is that online as of right now?
So the question about 4 Points and the hotel, I believe our speaker tomorrow is actually going to be Kate Green for Home for All, to actually talk about the plan for the city and the county in terms of housing. So she'll be better suited to answer those questions.
Monica, in Brazil, they stopped using the malaria drug because of really bad side effects. Is that something that's being considered here, or does that make you a little more hesitant to use it?
I think when it comes to questions about medication, and I think you're referring to in Brazil, malaria medication, the best advice is to speak with your healthcare provider. And if you do not have a healthcare provider, working through 211 or other entities to get established and get that baseline data that Dr. Nyla was speaking of, and what even Heartland is working on through some of our shelter populations, because your physician is going to be the best one to attribute and understand your health and what side effects you might have, what risk factors you might have, as well as understanding the type of care you might need. And so again, I would strongly recommend, for medical advice, seek out your primary care provider and get established with a primary care provider too.
I know that our local blood bank has started collecting plasma from people who have recovered, or at least they're offering to. Do you know, is any of that happening here? Are we using that treatment here yet?
So the question is about plasma collection for those individuals that are recovered and whether or not that treatment is started here locally. To my knowledge, we have not started that treatment widespread throughout the state. I think it's still really focused on those critical patients. Having said that, the Illinois Department of Public Health has been working with individuals that are now recovered, reaching out to them through the health departments and their physicians for referrals to see if they would be good candidates to actually donate. And so that is one process that started. And again, that's through a referral with your physician, understanding what other health concerns that individual might have. Well, thank you, everyone. We will see you guys tomorrow.